Hello, and how are you? My name is Winnie Barawa. Welcome to our session on significance of health policy. If you've been following closely, we are doing a new playlist that is on health policy. So we are introducing the different parts. We've done the concept bit. We've also gone ahead and looked at the different types of policies. And for this case, we'll be looking at why is it important that we get to have a health policy in any settings, whether at local government, offices, management levels, or the different types of policies that we have, depending on the different issues that we are looking at. So stay with me all the way to the end. And just to remind us, if you always come and you've not subscribed, please do so. And if you're a new subscriber, please remember to click on the subscribe button. Also leave us a comment and give us your view on what you feel we can do better or we can improve on. So let's start with first reminding ourselves what is a health policy. In the previous slides, we did definition of policy in general, and we said this could be a statement, guideline that helps us in making decisions, coming up with actions, and also looking at the outcomes. But in specificity, when we are defining a health policy, we will actually say this is a set of decisions or commitments that helps us to pursue the causes of action whose main role is achieving defined goals for improving health. So because health policy is an issue-specific type of policy, in this case we are defining it in this manner, that this could be a statement, decisions, or guidelines that are committed to help us pursue the cause of action in achieving health goals. So I hope that makes it clear. And in this case, it can also be a collection of specific laws. It could also be a collection of programs or some form of entitlements. It could be regulations, directions, or conditions that basically look into all aspects of healthcare system and improving into these areas differently. So if you're looking at, for instance, improving maternal health care, there's some policies that cater for that portion specifically. And if maybe you're looking into different aspects of healthcare like mental health, there's also specific policies that assist with doing such aspects. So health policy examples that can help us understand. You can have health policy also based on different levels or different roles. And with the health policy example, you can have the global health policy. And we are told the global health policies, what they do, they give a global governance structure that will help us create policies underlining public health throughout the world. So this will be looking at policies cutting across, for example, national level, international, all the way to coming up with conventions or international conventions, which will be guiding different countries and helping them make decisions in regards to these particular areas. Then we have public health policies, which look into issues of vaccinations, could be also tobacco controls and so on. And then you can have insurance policies or even mental health policy. So these are just examples of health policies. So the WHO actually states that health policies are strategies and plans that are expected to play a key role in defining a country's vision, priority, budgetary decision, and also cause of action for the purpose of improving and maintaining the health of its people. So this is the key function and the key significance of the health policy as guided by the World Health Organization. So according to this WHO, there are key parts that the health policy should always look itself into in terms of priority, and that is definition of the vision, being able also to prioritize maybe specific area of focus for the health issues, and then there's budgetary allocations in terms of budgetary decision, how much cost planning and all that, and then the cause of action. This is more of like the implementation strategies when it comes to improvement and maintenance of health of the people in that particular country. So I want to believe this is one of the global aspects which significance of health policy looks into. But again, when it comes to this significance, I always advise that you break it down according to the circumstance that you are in, or also the area of focus that you're particularly operating in at that particular time. So in this slide, we'll focus on specific or broken down significance of health policy, and one of it is definition of the vision for the future, which is also one of the area of focus by the WHO, that the health policy by WHO definition is it's supposed to help you define the vision for the future. Like, what areas are you trying to focus on? How are you going to improve on these parts? What is the bigger picture for you in terms of these areas? And then outline priorities. And in outlining priorities is using the problem trees or using the priority matrix. Which priorities of health are we going to look at? And in this priority of health, just to remind us, when it comes to cycle, the planning cycle, which you have covered in the slide on, no, not slide, sorry, on the playlist in healthcare planning. The planning cycle, there's an area where you need to set priorities, and you can do problem matrix to just see which problem is more important in terms of severity, in terms of magnitude, or even parts that can be focused much on. You can still do that. Then you can also use the health policy to outline expected roles of the different groups and stakeholders. Remember, in the health policy, there are parts of and roles that are to be played by different key holders, and these are important bits that can be outlined in this health policy, especially if you're doing a written health policy. Then there's an advantage of building consensus, and in building consensus, this allows us to build an agreeable point of view in terms of where are we going as an organization, where are we going as a team, what are the responsibility we are doing together, and which input are we all bringing into board. And then there's resource distribution and or resource allocation. So it promotes equity, equality, and fairness in resources, because for effectiveness of resources, you need to build traction on the aspect of how much and how far are we giving in terms of this particular area of health that you're working in. It also allows sustainability of interventions, and interventions can be very varied. It's not cut on stone. It can be very varied. It can be from interventions that are looking at solving an immediate problem, or it could be an intervention that is looking at long-term implications. And so the sustainability of these interventions can be guided by the health policy. And the other bit is addressing disparity for the promotion of better health for all. Remember, the focus areas for health policy may not be given the same magnitude. And in some spaces, you can find that a particular area has not been given priority, yet it's a very, very important key area. So to address this disparity, a well-outlined health policy should be able to bridge that gap. And then a health policy is also a good tool to assist in the decision making, that is, for example, in legitimizing actions for the stakeholders. So if you find you're working with different ministries in a state of multi-sectorial participation, having a good health policy that outlines each and everyone's roles makes it so easy to formulate action plans for these different parts. And then there's provision of a clear framework on how to work on particular bits or to improve on different parts. And then there's also clarification all the stakeholders that are involved for the different parts of implementation. So stakeholders are key parts, or these are people who possibly have interest in this health policy. And so when you pull in all the stakeholders that play a role in this health policy, it even makes it more team spirited. It brings a spirit of unity, and the variables are so easy to be implemented or to be adhered to. And then the other bit is provides a good idea about resources needed and how to attain the different goals. So it provides you a guideline on how to allocate resources, on how to put the different parts together. And remember, resources is not just about money. Resources could be even the human capital, the time capital, the funding that could be available, the technicalities and skills that are needed for this particular health policy to be put to life. So looking at the resources, it gives you a broader idea of what aspects needs to be incorporated into. And finally, I would like to thank you for staying with us all the way to this end. Please don't forget to subscribe if you're coming back. And if you're new, please give us a subscribe button there. share with your platforms, leave a comment, and like the video if it's really meeting your expectations. Thank you. Until we meet again. Bye bye.